Orthopedics covers a wide range of ailments and conditions. The orthopedic team at Mercy Health specializes in treating the full scope of these issues, from trauma to hip and knee. Dr. Alex Gildy, a fellowship-trained orthopedic surgeon specializing in hip and knee, is here to discuss the benefits of seeing the orthopedic team at Mercy Health. Good morning to you.
Good morning. Thank you for having me.
It's our pleasure. So what are the specialties of an orthopedic surgeon?
Orthopedic training is 5 years residency following medical school, but a lot of orthopedic surgeons go on to further subspecialties. Those cover trauma, or people who specialize in pelvic and acetabulum fractures, people in bad car accidents, orthopedic spine surgeons, hand surgeons, joint surgeons, orthopediatrics, folks who do orthopedic oncology, sports, and then as well as foot and ankle. So really just about every part of the body gets covered as far as the subspecialty goes.
And you touched on a few of them, but what are some of the most common orthopedic issues?
By far and away, certainly as our life expectancy has gotten longer and, like our baby boomers getting into their 70s, 80s, certainly arthritic joints, most commonly knee arthritis is a very common thing we see. However, certainly see a lot of hip arthritis, shoulder arthritis, those types of things. Obviously, folks slip, fall, break things all the time, so fractures is a common thing we see as well. But then there's also other types of things that we see as far as carpal tunnel syndrome or any type of neural impingement, whether that be spine or in the extremities.
All right, let's go ahead and talk about things that people can do to prevent some of these injuries.
Certainly from a fall standpoint, especially as folks get in their 60s, 70s, 80s, and evaluating your home environment is a big thing, trying to eliminate fall risk, things like rugs, bad thresholds, those types of things. Those are all tripping hazards. Certainly from a personal standpoint, folks making sure that their bone health is as good as it can be. We do have bone health specialists that help to optimize folks' quality of their bones. There's also certainly having a discussion with your primary care physician if you have concerns. Living in the state of Michigan, a lot of us are vitamin D deficient, so that's a big thing as well. So not only avoiding things that can cause falls, but also optimizing your bone quality can help prevent fractures and needing surgery, those types of things.
Absolutely.
As far as a arthritis standpoint, really, from a preventative medication kind of thing, we really don't have much for that. But as far as folks keeping active, trying to keep their weight down, trying to maintain a healthy lifestyle, certainly makes life easier on arthritic joints.
Absolutely. And genetics plays a role in some of this too, right?
Absolutely, for sure. Traditionally arthritis was wear and tear. There's certainly, inflammatory types of arthritis between rheumatoid and those types of things. But honestly, from what I see, it's probably more of a genetic standpoint that we don't fully understand yet. That's just my own personal opinion. Mm-hmm. But we certainly see it a lot of times in females with bad hands. When they have hand arthritis, say, okay, was it your mom or was it your grandma who had bad hands? And that's a common thing we see.
Absolutely. Well, Mercy Health Orthopedics has several accreditations, including the Joint Commission's Gold Seal of Approval. So what does that exactly mean for the program?
So the Joint Commission is a kind of an independent, third-party accreditation company. And what they do is they really kind of evaluate a program all the way from the beginning, even before a patient gets surgery, day of surgery, after surgery, and then, how do we follow them in their post-operative period. And it kind of looks at protocols, it looks at current standard of care, and kind of, really evaluates a program to see if it's up to par. And it's really kind of a standardization process. And, certainly it's a good thing for the hospital. It's, it's not that they get any more money or anything like that. It's really a feather in their cap. But more importantly, it's kind of a reassurance to the patient that, hey, these folks are getting checked. They are doing a good job. Other people think they're doing a good job. And so it's kind of a checks and balances for folks, for patients to be assured that they're getting good care.
All right. Well, Dr. Gildy, thank you so much for your time this morning.
Absolutely. Thank you.
Absolutely. For more information about the orthopedic program at Mercy Health or to schedule a consult, visit mercyhealthjointcare.com.